Welcome back to the Wise Woman Initial Program Training. This is the second video. We'll be talking about the chronic disease risk factor screening. This is the first part of it. The Wise Woman screening has 4 parts. We will be obtaining an informed consent, reviewing the Wise Woman health intake questions, doing the actual clinical screening, and then conducting case management if needed. That involves hypertension case management or alert value case management. So we'll be talking about the first 2 in this video, and then we'll have 2 more videos where we talk about clinical screening and case management. This is the Wise Woman program flow. We won't be looking at the whole thing in these videos. What we're going to focus on is the top part of it, and we will actually cover the outcome management in the Community Navigator training. All right, first thing we're going to do is look at the informed consent form. That's our first form, and this is it here. Let's take a look a little bit closer. The form is written in plain language so that anybody can understand it. We did that because we want the women who are in the program to understand what's happening and not just take it as it's coming. Most informed consents look like they're written by a lawyer, and they're very difficult to understand what's happening. This one we really tried to make sure that the women understand what's happening. So we talk about what services they're going to be getting as a participant. They'll be answering some questions, and that if they need to be, they'll be referred to medical evaluation. And at that point, it's their responsibility to keep all their appointments. And then also, if they're interested, they can work on some small steps and goal setting. And that's only if they're interested. We really try to meet the woman where she is. So if she's not ready to start making changes, we don't want to try to push her into anything because she's not going to be successful doing it. Also, we talk about who's going to be paying for the services. And then this last part is very important. This is the physical activity restriction questionnaire. If she answers yes to any of the questions on here, you don't want her to be doing any kind of physical activity until she gets clearance from a medical provider. That just helps protect her and protect you. All right, so that was the informed consent. Now we're going to get into the health intake questions. The first set here, let me back up a little bit. These questions are all, or most of them, come from our funder, the Centers for Disease Control and Prevention. There are a couple of questions that we ask because of things we need for our program in addition, but for the most part, these come from the CDC. So the first question, we're looking at the highest level of education, and the reason for that is because there is a correlation between education, level of education, and overall health. We also ask about what language is spoken in their home, and then we get into the health history questions, the personal health history, with the questions about cholesterol. Also, personal health history, we're looking at if she's been told she has hypertension. And question 7 there, we're looking at whether she's taking medication, and that question is asked with cholesterol, blood pressure, and blood sugar. If she answers that no, she could not get medicine, that's your cue that you need to help her out with some type of prescription assistance to make sure that she is able to get and to afford to take her medicine that she needs. Last section there is on diabetes and whether she has it, whether it's type 1 or type 2. Next section is on personal and family health history. So we're looking in question 13 about whether she has a personal history of cardiovascular disease. And then the next 2 questions we're looking at if there is a family history of premature heart disease. Then the last question on there is looking at whether there is a family history of diabetes, because all of these things, any type of family history, does raise the risk of these various diseases. The next section is on home blood pressure monitoring. We ask them if they monitor their blood pressure at home. If they do, how often do they do it? And if they do it, how do they let their provider know what the readings are? And then our next section here is on nutrition. So we're looking at how much fruit and vegetables they eat, if they eat at least 2 servings of fish weekly, because that is heart healthy. We're looking at whole grains, how often they eat whole grains, and then we're looking at if they drink sugar-sweetened beverages, and if they do, that they drink less than a certain amount of them. Next section continues a little bit of nutrition. We're looking at sodium. Are they monitoring how much sodium they're getting. And then we look at minutes of moderate physical activity and minutes of vigorous physical activity in a week. Then the next section here is on tobacco use and secondhand smoke. So do you smoke? And if you do smoke, how much do you smoke? Do you use e-cigarettes? And then are you interested in quitting smoking? So question 31 is a stages of change question. We're looking at if they're not even thinking about it, if they're maybe in pre-contemplation, if they're in contemplation, or maybe if they're all the way ready to quit smoking. So that gives you an idea of whether or not they're ready to actually quit. And then the last question on there is looking at secondhand smoke. So how often are you in the vehicle or in the room with somebody who smokes? If they smoke themselves, it's not as big of an issue. But if they're a non-smoker and they're in around a lot of smoke, then that can be a real hazard for them. Then the last section on there is about quality of life. So in the past 30 days, how many days has health not been good? How many days has mental health not been good? And then how many days did either poor physical or mental health keep you from doing what you would normally do? All right. So that's the health intake questions. We look at all of those with the woman. She usually fills that out ahead of time. In some cases, you might need to help her fill them out if she has questions about them or if she needs you to actually fill them out for her. But we did a couple of things here. Let's take a look at the summary. We looked at the informed consent and what were some of the important parts of that. We've looked at the health intake questions and how to review some of those. And in our next video, we'll be doing the part 2 of the chronic disease risk factor screening, and that will be the actual clinical screening.